My name is Jeanette Smith, and today I'll be talking to you about diabetes nutritional education. It's a course that I've created for my capstone course in my master's degree program, which I am currently in my last class of my master's degree. And first, I want to speak a little bit about my background and experience as a nurse. I have been a nurse for nearly 8 years, and predominantly I've worked on a neurology and cardiology floor. And with working with those patient populations, I've seen about nearly 50% of our population having diabetes. And that has really resonated with me, with that growing population and caring for that population within our community, and supported me choosing this topic for the module I designed for the course. And also, I've recently been able to step into a role at my local hospital as a stroke coordinator and doing education, and I've realized just how valuable it is to work with populations that are experiencing an acute health crisis, because most times more than not, there are modifiable risk factors, and patients may not be aware of what those modifiable risk factors are, but I can come in and work with them. And that's really always the positive side of nursing, is that we can impact patients to make those changes and have better health outcomes. I've also worked the past 2 semesters at our local 4-year university with the nursing program, teaching students clinical. And that has also been very rewarding because I'm really excited when I work with students to show them that whatever type of nursing they're interested in, to help guide them and provide them more experiences in their interests, along with just realizing that I'm passionate about empowering my patients and my students. So what we can do is create individualized plans that are realistic to lead to both of their successes. And also, I've just realized that when you work with the patient or student and include them in on the goals, you really do see positive outcomes. Okay. So I just want to welcome you to the course I've created. It is for students that are in a nursing program prepared at the bachelor degree level. And the course will be taught during the medical surgical course that's in level 2, semester 2 of the nursing program. It is an 18-month nursing program, and it's considered a fast track because the students go through the summer. And the course that will be taught will be diabetes nutritional education to the students. And then next, I want to talk about the identified gaps that I realized while completing my course, is that the current practice of educating nursing students on diabetes and the routine medical treatments in nursing is not adequate. At different universities, students receive different education and or different levels of how much time they spend in talking about nutrition to manage diabetes. And when I did my literature review, I found that not all nursing students feel confident enough to educate their patients on proper diet and assist them in controlling their blood glucose. And that was really insightful to me, because if the students are not feeling comfortable when they get out into practice, that's likely going to continue that they still feel that same way if they haven't gained that confidence or experience while in nursing school. And then while I was doing my literature review at the hospital, I also went and worked with my mentor, and what we saw was that it is a challenge of the nurse on the floor, because for them, a lot of times they rely on the doctor to put in a nutritional consult, and not all patients get to meet with a dietitian to work on their diabetes. And then there's either a time barrier for the education, and or the nurse does not feel comfortable or confident in being able to provide that education to the patient, along with the nurses not being able to implement that as a proper intervention for their patients. So what we looked at is what patients were receiving diabetes nutritional education, and when it was happening throughout the course of stay or at discharge, and then in addition, how well their blood glucose was managed throughout their hospitalization, and then looking at patients that are readmitted. And so what I realized is that, like I talked about, the practices vary with that amount of diabetic education that nursing students receive, and then we want to make the learning realistic to the patient that is living with diabetes. That was one of the main focuses for this course, and also adding that diabetic nutrition to curriculum to provide students with skills for educating their patients and providing them with hands-on learning opportunities and really creating learning experiences that engage the students to prepare them to care for the diabetic patient. And then I will talk about my learning materials. So the first learning material I have is the CDC website. It's a wonderful resource for the nursing student and the patient because it goes in depth on nutritional education. And when we provide patients with a resource they can continue to access, and in the modern world, a lot of people do have access to technology. So maybe if it's not the patient, maybe a family member, they can pull up the website on their smartphone devices or tablets or computers and access that once they go home. And then the last two resources I have are textbooks. And the first textbook is Nurse's Guide to Teaching Diabetes Self-Management. So this really helps support the nurse to be able to teach their patient on diabetes and how to self-manage that. And then the second textbook is Textbook of Medical Surgical Nursing, and that textbook was chosen because this course module is taught during the medical surgical course, and just giving the patient or the student a really good idea of what it's like to care for the diabetic patient. So this textbook supports learning the entire, essentially, care plan for a patient with diabetes and how to manage that. And then I'll talk to you about diabetes nutritional education for the course objectives and student learning outcomes. So for the first course objective is that by the end of the course, the student will apply diabetic nutrition education to promote patient blood glucose management. And then for the second course objective, by the end of the course, the student will develop a nutritional care plan for the diabetic patient. And then the last and third course objective is by the end of the course, the student will articulate how to connect diabetic patients to local nutritional resources. And then for student learning outcomes, the first one is after completing the module by week 6 of the course, the learner will be able to describe a nursing care plan with 2 modifiable patient-centered nutritional goals that focus on diabetes management and self-care. And then the second student learning outcome is after completing the module by week 6 of the course, the learner will be able to explain 3 diabetic nutritional resources and the impact they have on diabetes management. So for the course objectives and student learning outcomes, I really wanted them to align and focus on the nurse being able not only to provide that diabetes nutrition education, but how it's going to connect to making it patient-centered and creating those goals and making it realistic and really promoting the patient's health upon discharge from the hospital. And then furthermore, how we're going to connect the patient to resources, whether it's national, local, so that once they leave the hospital, they do feel empowered and have that support to know how to manage their diabetes. For the course, the major topics that will be covered are blood glucose management, carbohydrates, portion control, diabetes resources, sick days, sugar, and alcohol. And then for the instruction, how that will be met is the first one being through lecture. The second will be discussion. The third is small group work, and then also having clicker questions. So I do have an example of the clicker question, but those would be embedded throughout the lecture to keep the students engaged and interested in the content that's being provided. So I would want to provide an introduction to diabetes, and what has been shown is that there are 422 million individuals living with diabetes worldwide, and that accounts for 1.6 million deaths annually. by 2040, it's expected that the worldwide amount of individuals with diabetes will increase to 642 million. And diabetes is a disease often of unhealthy lifestyle factors that can be modifiable. It is a chronic disease that can be preventable for type 2 diabetes and managed successfully through lifestyle modifications. The disease process can be debilitating if it's not adequately controlled, and the profound impact of diabetes on patients is devastating. However, it can successfully be managed by making better lifestyle choices, and there is a need to increase the nurse's knowledge to be able to educate their patient on diabetes and self-management through focusing on nutrition. And then some risk factors that if diabetes is not managed or is uncontrolled can also lead to other disease processes such as heart disease, kidney disease, stroke. So we really want to place that emphasis on educating the patient that there are other risk factors. These are not the only ones, but knowing, okay, if I successfully manage my disease process, I cannot obtain more comorbidities and I can have health. And knowing that even though diabetes is a complex disease, it absolutely requires a nurse's knowledge to work with the patient to identify their barriers and strengths to manage their disease. Okay, and then I'm going to talk about the course outline. So first we would talk about blood glucose, just because it's a really big important part of managing diabetes. So we want the patients to routinely monitor their blood glucose and have their A1C lab testing done routinely as well. And then we'll talk about carbohydrates, since the emphasis of this course is on nutrition. And what we would talk about is carbohydrate counting, whole grains and whole foods, promoting that. And then portion control and eating out. So having a balanced diet, looking at what a food plate for a diabetic patient looks like to help them understand what the portions would reflect in a balanced diet for a diabetic patient, and then choosing healthy options. And then moving on to special considerations. So when patients are having a sick day or they're under a lot of stress, what that looks like, and managing sugar and alcohol intake. And then we'll go over a summary of the major concepts and then allow the students to have a question and answers for anything that they would like to speak about, or if they have questions at the end of the lecture, just to reinforce in real time to give the students feedback. And then I've created what it looks like for diabetes compliance. So we have the patient at the center of all of the care and all of the monitoring, all the interventions they want to do. So that's something I think for the patient and diet is really at the center of how we can support the patient. So if patients don't learn how to manage their blood sugar, or how to count carbohydrates, or balance their meals, or choosing any alternative healthier choices, we really want to set those individual goals while the patient is inpatient. And diabetes education is often a missed opportunity, like I said before, because it's time consuming. The nurses may not be as qualified, and we want to empower the nursing students so they can better assist their patients in making healthier food choices and controlling their blood glucose and providing them with resources. Diet is an integral part of health for a diabetic patient, and it provides the body with proper nutrients, vitamins, and minerals to function optimally. Lacking diabetic nutrition education is detrimental to the patient and their outcomes, and it can lead to extended hospitalizations and rehospitalizations. Okay. So for the first topic, we'll be talking about blood glucose management. And this is something that with each patient that has diabetes, they do need to be monitoring and checking their blood glucose. So they first want to do that when they wake up, and then before each meal, and ideally 2 hours after a meal, and then lastly at bedtime. And then the patient wants to have their blood sugar lab tests through the A1C testing that measures their average blood sugar over the past 2 to 3 months and keep that within a goal range that they determine with their primary care provider. So this is also a really important piece for the patient to know. Once they discharge from the hospital, they need to have an A1C test done so that they can look at their diabetes control over the last 2 to 3 months and determine if they are meeting their goals or if they need to modify them. And then also it's important for the nurse to ensure that each patient has a working glucometer. They have Lancet, so they are able to get a drop of blood and check their blood sugar, and then strips, and then that they know how to work the glucometer that they have. If not, they do need to order for those diabetic supplies. And also sometimes it's nice if when the patient is discharged, if they have a hand slip written lab so that they can go get their A1C drawn within the next couple of months, and then letting the patient know that once they are discharged that they need to follow up with a primary care provider to continue to work on their diabetes management, since diabetes is a chronic disease. And then we'll talk about the diabetic diet. Like I said, with diabetes management, we do want to be checking the blood glucose before each meal and at bedtime. And then I've included what a well-balanced plate of food looks like. So half of it would be vegetables, and then a quarter of it would be carbohydrates, healthier food options there that we'll talk about. And then a food protein, and then making sure the patient is drinking enough water. That's very important to stay hydrated with diabetes. And then choosing high protein and high fiber snacks. And then also helping the patient to know they need to choose whole foods versus processed foods. So when they go grocery shopping, having them shop on the exterior of the store and letting them know that a lot of the processed foods or foods they want to avoid or limit usually are at the core of the grocery store. And that can be a helpful way to quickly help them understand that this may be a change they need to make, or they may identify that they're already doing that to help manage their blood glucose. And then the patient will be learning, or the students will be learning about carbohydrate counting. So aiming to consume the same amount of carbs each meal, and then limiting carbs with added sugar. So that's where we want the patient to be looking at nutrition labels, flipping over the packaging and looking at the sugar amount on that. And then the amount of carbs really depends on the patient's age, weight, activity level, and sometimes other factors. So connecting a patient with a dietitian outpatient will help them to determine what is best for them. And then patients, when they check their blood glucose, they might start to learn, or we hope that they'll learn, teaching them that when you're checking it, you can monitor and see if you notice you're getting these spikes with different carbohydrates, then patients can choose to either limit that even further or avoid it altogether. And then for diabetes management, we will be talking about portion control and eating away. So with portion control, we want to look at those serving sizes on that nutritional fact label, because sometimes it might be that it's 4 servings and that patient may not be aware that they need to only have a fourth of that to have it be 1 serving. And then looking at making sure that it's a well-balanced meal. And with our portions, like I had shown on the plate a couple slides ago, and then choosing once again high protein, high fiber snacks. So avoiding anything that's processed with sugar, and then whole foods versus processed foods. And then when a patient is going to be eating away, eating out, going to a function, it could be a holiday work party, that they empower themselves to make choices ahead of time to know that there could be temptations as well. So if they're going to a restaurant or even being served at an event, just knowing that serving sizes are larger than what is actually advised for a diabetic diet, and then planning ahead on what you're gonna have so you can pull up the menu from the restaurant and essentially choose what you're gonna have ahead of time so that when you're there, you're not overwhelmed and not making the right choices for diabetes. And then also having a healthy snack prior. If you're fueling your body with the right nutrients prior to leaving, then you'll have more satiety and feeling full, so you won't be tempted to eat less healthier choices. And then choosing the baked options versus fried food. So if there's fried chicken versus baked, always choosing the baked chicken and just making those small changes that can over time lead to better blood glucose control through diabetes management and nutrition. And then drinking plenty of water, and then avoiding chips and bread. So if you have a snack prior to going out and eating, then letting the server know that you don't want the chips or bread to be served. And also, if you're with a group of individuals, just explain to them that you're making healthier choices and that's why you want to avoid that. Having support also really helps patients with diabetes manage their nutrition. And also, just because chips and bread are carbohydrates that are not healthy and will cause a spike in blood sugar. Okay, so then the students will learn about special considerations that include sick days, stress, and monitoring. So for the first one, if the patient cannot eat, they're nauseated, they're not feeling well, then we want them to drink 50 grams of carbs every 4 hours. So this is a time when patients can have popsicles, they can have juice, and then they want to know their doctor if they're notify their doctor if they're experiencing any complications. And then with stress, when patients are under high periods of stress, they might also notice it's challenging to manage their diabetes blood sugar. So that includes physical and emotional stress because it does increase blood sugar. And also being mindful of their mental health. When you're under more stress, it can impact your mental health. Therefore, sometimes people go to more comfort foods and snacking, and not having that awareness that with that stress that food can provide comfort. However, it's not going to help them with their diabetes, and their blood sugars might be more elevated. And then also sometimes people are more inactive during high periods of stress or feeling depressed. Those things can be normal throughout life, but if it goes on for too long, then the patient really needs to talk to their primary care provider about it and how it's impacting their diabetes and come up with a plan to address that. And then with monitoring, we want the patient to test their blood sugar every 4 hours. If it is not being well managed, they need to talk to their doctor. They need to reach out for any worsening symptoms and or go to the hospital. They can also monitor their blood sugar even more frequently, so every hour, every 2 hours, depending on their symptoms. So it's really kind of individualized based, but if they are having a challenge with that, then they need to know to get to a treatment with either their primary doctor or at the hospital so that they don't go into any further complications of like diabetes, ketoacidosis, and knowing what hypo and hyperglycemia look like and ensuring that that is part of this conversation as well. Okay, so I have a clicker question provided for the students. So this would just be sent out to the students, and the answer would not be prompted up here, but the question would be, when a patient with diabetes is sick, how often should they check their blood glucose? And the answer would be every 4 hours, but I would also have other options. So it could be at bedtime or daily, and then the actual correct answer would be A, every 4 hours. So as the instructor, I would poll the class and I would allow them about 2 to 3 minutes to ensure everyone has answered the clicker question. And then I would do this throughout the lecture at about every 5 to 8 slides. And then what I would do is just to kind of quiz them on the previous material I just presented and to continue to keep the students engaged. And then for resources, I had talked about the CDC website. I would include that to teach the students about and show them that, and then also teaching them about providing their patient with resources to a local registered dietitian, and then also realizing that medical nutritional therapy is a great option for patients. A lot of times in Western society, we don't always realize that we need to include more education about nutrition because nutrition can be seen as holistic medicine, and teaching the patient about that because this may be the first time that a patient is hearing about nutrition as a way to help them be healthier, And then as the patient starts to make these choices and realizing that they do feel good, or if they're eating foods with less sugar, that they might start to notice how sugary the foods they previously were eating, even if they were consuming a lot of soda, they might start to realize, okay, I'm actually fine without having that much soda, and realizing that that was a contribution to their blood sugars being elevated. And then also I would educate the students that there is, right next to our hospitals that are downtown, there is the Hopes Clinic, and they provide care to patients that are underinsured or not insured. So they do a sliding scale, so there's little to no cost to see a primary care provider. And then they also have a pharmacy, so they provide the patients with their medications. The importance of getting connected with a clinic like this is that whatever the patient is discharged on, that they need to be able to go pick up their glucometer medication. So they need to know, okay, where am I going to go? And if I can't afford that, what does that look like? Also, whatever prescriptions they were provided with, they only have a 30-day supply once they're discharged from the hospital. And we want them to know the next steps, having those resources to be successful in managing their diabetes and feeling empowered to take care of themselves after their discharge. And then we'll be talking about sugar and alcohol intake. For both of these, moderation is important. And then planning ahead for holidays and eating at restaurants or any functions outside of the house, because that's when times of high sugar, high alcohol, those temptations can be there. And knowing that sugar and alcohol raises blood glucose, and an elevated blood glucose causes damage to the body over time. So these can be areas that can be challenging for patients just because of social factors. But I think over time, patients can realize that moderation and or entirely eliminating or eliminating to a degree which is healthy for them also empowers them to feel better. And then we'll go over the summary. So for the summary, we'll go over the key concepts, which were blood glucose, carbohydrates, portion control, diabetic resources, sick days, and sugar and alcohol intake. And then just reviewing ways that we can make the education patient specific. So if students have a patient they want to bring up that they've seen in clinical, we can talk about that. And then realizing that when they speak with patients that they want to ask open-ended questions and provide patients with written education so that they can take that with them, because a lot of times when patients are sick and have a new disease, it's overwhelming. So then later on they can have printed education that they know, okay, this is what I can reference back to. And with that written education, having a log, so patients can be keeping a log of their blood glucose and taking that with them to their follow-up appointment. And then the students would have an opportunity to have questions and answers. So at the end of the lecture, they'd be able to ask more detailed questions and receive those answers, and receiving timely feedback. So also with using the clickers throughout the lecture, it just helps to receive that feedback in real time. And then at the end of the lecture, the students are going to break out into small groups, and they're going to go over a case study. And there will be 2 other instructors that will come in and help manage the small groups. So when the students are working in these small groups, they will be answering questions, and then they can be asking us questions about the case study, so we can point them in the right direction. That might help them to change their answer, and just receiving that real-time feedback. And this will also help them to learn how to collaborate professionally. Sometimes for students, this is a new role of working as an interprofessional team. So we want to encourage that characteristic of a nurse, along with working in that team environment to help the students engage and also really dive into a realistic patient. So the case study is going to be providing a realistic scenario, and then they can take that knowledge, and when they go into their clinicals and they have a diabetic patient, they can start to apply that quickly, and because the case study will help them to see how it translates into real practice. And I think making that education realistic for their practice is very important as well, since sometimes even in level 2, the students haven't had enough experience with the diabetic patient. The more empowered the student is, the more likely they will be to provide that education and feel confident to provide it to their patient. And then lastly, I will provide my students with my information as well. This is also included in the syllabus, but also just letting them know I'm Professor Smith. I've provided my phone number and then my email, and then I also have office hours daily from 2 to 5 p.m. So the students can reach out and know that throughout the week I am always available to them. And then also there'll be open lab on Thursday mornings from 8 to 10 a.m. and that's by appointment only. The reason for that is because the open lab can only accommodate a certain amount of students. And so with that, I also want students to reach out ahead of time and inform me of what they would like to work on skill-wise or areas of the course they're struggling with. So if they have an appointment, then I can be adequately prepared to address their needs. And then also just encouraging the students to reach out with any questions throughout the semester, letting them know I'm very accessible and that I really care about their success and the success of their patients, and reminding them as nurses, and we as nurses, we are educators of disease processes, and through education, it's very empowering how we can help patients see positive impacts, and also through our enthusiasm, that encourages the patient. So the more educated we are, the more we know about topics that might feel complex and can make it simplified for the patient, the better outcomes they will have, and it's a true reward of our profession. Thank you for listening to my lecture in the course I created, and I look forward to hearing your feedback.